Okay, well, first of all, let's understand what an outbreak, an epidemic, and a pandemic are. By definition, an outbreak is when a disease, whether it's new or not, is in greater number in an area than what's normal. That's an outbreak. When that increases in an area to a certain size, depending on the area, it's an epidemic. When it starts to cross borders and impacts other countries, by definition, it's a pandemic. Once it impacts several continents, then it's a global pandemic. Those are just basic epidemiology 101 terminology. And so those terms don't happen to be in the international health regulations. They're assumed that people understand that. The role of the World Health Organization is to call or not call an outbreak or an epidemic or a pandemic a public health emergency of international concern. And that is precisely what WHO did do on the 30th of January. Now, it's true that they did debate it for over a week as to whether or not it had reached that level back when it was still mainly confined to China, because it still was mainly, to everyone's knowledge, confined to China in January. To the best of anyone's knowledge, we did not know that there was community spread anywhere else at that time. But still, as more and more data was coming in, WHO recognized that it was being transmitted at a higher rate than other diseases, and that it was causing a higher fatality rate than many other diseases, and they saw fit to use the term a public health emergency of international concern, which is the term of art that is supposed to be used under the IHR of 2005. They didn't use the term pandemic because it's been Hollywoodized, and people wouldn't understand, they thought, what that actually means, what this epidemiology 101 teaches us it means, which is just about spread and not about how dangerous or not dangerous something is. They withheld that, and they kept warning about the more and more serious things that everyone in the world was discovering about how SARS-CoV-2 works. But they noted that many countries throughout the world were not paying attention, weren't giving it the due importance that it required. And so in early March, the WHO decided that perhaps if they used the word pandemic, it would catch the attention of those nations that weren't attuned to how serious this threat was. And in fact, doing so did have that impact. All right, to be able to reopen, we have to see that we're on the downward swing of the epidemiologic curve, that we've brought the reproductive number below 1. And that takes time. It's not a matter of plateauing, that's too early. It's a matter of actually being on the other side of the curve. So it takes surveys and studies to see what's happening in our community. It also takes forethought. We have to understand what is if with the measures that we are taking, what is the projected number of cases, and do we have enough beds, general hospital beds, ICU beds, ventilators, medicines, trained personnel for the numbers of people expected when we stay in lockdown versus when we lift the lockdown, because lifting it will almost invariably lead to some additional contagions. So we have to calculate that into our figures. Can we manage it? That's important. The next thing that you have to take into consideration is how you're going to do it. What is the particular mechanism that you're going to apply, and how quickly you're going to be able to surveil. And to do that, you need testing. And that means that you're going to have to test not just the individuals that are symptomatic, but every single close contact. That means, like, for example, all the household members of anyone who's positive, because we need to detect those asymptomatic cases and isolate and treat them until such time as they're no longer shedding virus into the environment. And that's a crucial piece of the puzzle that we haven't been applying and need to apply very, very swiftly so that we can do this in a systematic way and then release people into the population that are safe to be out there, but who should nonetheless be taking those measures that we've already spoken about in an abundance of caution, such as wearing masks and trying to stay a 6-foot distance from other people, even though they're all out in the community, those individuals. And again, and a lot of communities are now talking about staggering children going back to school so that the hours are such that you have fewer numbers of children per classroom to, again, try and maintain that social distancing as much as is feasible. There's always going to be challenges, but the better we do this, the sooner that we can reopen things. And of course, in the meantime, we work really hard at coming up with a vaccine or a pre or post-exposure antiviral that can help knock the virus out of a human community.